So patients with facial paralysis have a tremendous emotional burden. There's no question that our face is sort of how we are viewed by the world. And so when we go out, the idea of putting your best foot forward, also goes with putting your face forward. And so that is the first thing that people see. And we understand that it's a major impact to have a change of any degree in facial appearance. So the goal is to reach out to those people and let them know that there is always something that can be done. We have a lot of patients who have stopped smiling, and so people think they're mad all the time. Or we have people who don't go to church anymore because they don't want to see people, or they don't want to they go to the movies because it's dark. They don't want to go to a concert or someplace like that. So, the point is that finding people through an organization like this, people who have had similar experiences, and finding professionals who take care of patients like this, all working together to try and restore an active, healthy, happy life. I think it's important when you're getting started with this problem to see a wide range of people who have expertise in treating the problem. So, it's not just ear, nose, and throat doctors. In fact, people often come up to me and say, why is an ear, nose, and throat doctor even involved in facial paralysis? Why isn't it a plastic surgeon or a neurologist or that sort of thing? And you may need those people as well, but what you need are people who have taken an interest, who have spent the time, well-read, and see patients with facial paralysis on a regular basis so that they can both come to a proper diagnosis and then lay out a treatment plan. And the treatment plan, could be anything from physical therapy, it could be Botox, it could be surgery, it could be chemotherapy, radiation. It just depends on what the problem is, and the problems are wide-ranging. So patients who have already gone through a treatment stage, then they're either in a healing stage or, then there are patients who have chronic facial paralysis and needs related to that. And some of these needs are emotional, psychological. We work with a dedicated physical therapist who just does facial paralysis patients, and he provides a lot of support and encouragement and things that people can then take home and do at home. By getting people in the door and doing a needs assessment, updating perhaps somebody that I'd seen 10 years ago might have completely different needs for their facial paralysis than they had then. Coming in, following people long term to kind of adjust to changes that occur over time is really helpful for the facial paralysis patients on all levels.